Hello, I'm Arthur Fennell, broadcast journalist and healthcare advocate. Think about this. You know, the most valuable thing that we all have in life is our health. Now, it's not something we often talk about, but prevention matters. So it's time to get serious about protecting your health and the people that you love from colon cancer. It can be done. Here's some background. Colon cancer develops from abnormal growths, commonly referred to as polyps. Now, these polyps don't always cause symptoms, so it's important that you talk to your family doctor, especially if you're at risk, so you can be screened with a colonoscopy. It's also very important that we learn about colon cancer because sadly, each year, nearly 7,000 African Americans die from colon cancer. That's more than any other racial or ethnic group in the country. And as a matter of fact, colon cancer is the third leading cause of cancer death for African Americans. So, in the next few minutes, we're going to answer some very important questions about colon cancer. How do I know if I'm at risk for colon cancer? What is a colonoscopy? If colon cancer is found, what are my treatment options? And what can I do on a day-to-day basis to reduce the risk of colon cancer? As you'll hear from people who've been there, colon cancer can be prevented, and thanks to regular screenings and medical advancements, successfully treated.
Congratulations, I see you're going to have a birthday soon.
Yeah, I do.
You're going to be 51.
Please don't remind me of that.
Well, I'm looking in your medical record and I see that you failed to have a colonoscopy last year when I recommended it.
Well, Doc, I really don't feel like taking a colonoscopy.
Look, prevention matters. And as an African American male, you're at higher risk for colon cancer. You already are 1 year behind. You need to have this colonoscopy done. Let me give you a referral to Dr. Timothy Hoops, whom I gave you the referral last year. I want you to follow up this time. It's important.
But Doc, they tell me that those type of tests are very painful.
It's not painful, and it's a test that can save your life.
Well, Doc, I'm going to make every effort this year to get the colonoscopy done.
I'm pleased, and you should be proud of the very good decision you made today.
Having a history of colon cancer increases your risk for subsequently developing another colon cancer. Things that anyone can do to reduce their risk for colon cancer include stopping smoking, losing weight, increasing exercise, possibly taking vitamins such as folic acid, vitamin D, and calcium. However, the most important thing you can do to reduce your risk is to undergo periodic colonoscopies.
Guess what? Dr. McKee said just because I turned 51 years old, she said I need to take a colonoscopy because there's a chance I might have colon cancer. So guess what? I'm tired of this woman getting on my case. She got on my case last year about taking a colonoscopy. I didn't take it. So guess what? I'm going to do it so I don't have to hear Dr. McKee's mouth anymore. Can I ask you a question? Are you going to be able to take me to this?
Yes, because I love you.
Oh, thanks, babe.
Mr. Hobson, Dr. McKee sent you for a colonoscopy?
Yes, she did.
Great, great. As you know, the colonoscopy is being done for two reasons. One is to detect cancers, and the other one is to look for polyps, because by taking polyps out, we can remove cancers. So the colonoscopy is an examination in which we look at the inside of the colon. Because of that, we have to clean the colon out. The day before, you will take a couple of laxatives. These are mostly odorless and tasteless and fairly simple to take. The prep is no fun, but after you're done, the rest of it is fairly simple. You will be sedated during the procedure, and most people don't remember anything about it or feel any part of the procedure. Because of the sedation, you need to bring someone who can take you home after the procedure. In general, the procedure takes about 15 to 30 minutes to complete.
And you stated to me it's not a painful procedure, right?
Most people feel nothing because of the sedation. Well, I'm glad you're here. Remember, the purpose for this test is to prevent cancers and to detect them early if they are present. Nobody should die of embarrassment. Hi, Mr. Thompson. How you feeling?
Pretty good, Doc.
I've got great news for you. As you can see here, your colonoscopy was completely normal. You had no polyps. Because of that, you don't need to come back for 10 years.
If you'd had polyps, I might have said come back in 3 or 5 years, but since it's normal, you got 10 years. Is this your wife? Hi, nice to meet you. You'll be able to take him home in just a few minutes. After you get home, you'll be able to go back to your normal activities. Okay? Any questions? Give me a call. This is your doctor.
Prevention is the key. It can save your life. That's the bottom line. Cancer runs in my family. And I've been having that colonoscopy test now for over 20 years because of that factor. And it's paid off for me because they caught it in time. And here I stand today, cancer-free. I'm just so thankful again that I had that test and caught it in time, that it didn't do further damage, because we all know that cancer can kill you. It's your life, it's your health, it's your responsibility to take care of your body and your mind.
Well, as in Reverend Wright's case, the most common treatment is surgery. For surgery, we remove the portion of the colon that involves the tumor and reconnect the ends of the bowel. In most cases these days, this can be done through laparoscopy, which is a minimally invasive approach. The prevention matters because colon cancer is one of the cancers that we can actually prevent. With proper screening and removing polyps before they become cancerous, we can completely prevent people from getting colon cancer, and we can theoretically eliminate the disease.
My thyroid doctor, Dr. David Finkel, he suggested that I have a colonoscopy because of my family history. My mother and my grandmother both had colon cancer. Because of my family history, I should have had my colon cancer screening when I was 40, as opposed to age 45 or 50. If I had had my colon cancer screening when I was 40, it could have saved me the agony of even having the cancer. A lot of people don't get colonoscopies or get screenings, the baseline screening. A lot of people do not get it because they are afraid. Okay? And that's why I initially did not get mine. Prevention matters because you have to take care of yourself. You have to take care of yourself. And the best way to do that is to prevent something before it happens.
So let's recap what you've heard today. Colon cancer can be prevented by getting a colonoscopy and having any polyps removed. Colon cancer can develop for quite some time without symptoms, so those screenings are the key. If cancer is detected, there are many successful options that are available to you. The good news, it's very treatable when detected early. Now, we hope we've inspired you to become more aware of your personal risks for colon cancer. Talk to your family doctor, get those screenings, and more than anything else, take good care of your health. Prevention matters. I'm Arthur Fennell. Thank you for joining us.